West Group of Institution Bangalore, kakot admission nakamta ka nursing but paramedical course, kabala ithu da ka Indian Nursing Council, kabay admission kabadunatam, but she's pa percent ka jinyokam. Pila ru ban apply da ka education loan.
Doktor Elan Kumaran MS MRC, DNB MCH AIIMS PDF in liver transplantation. Ubadiu senior consultant, liver transplant and HPB surgeon ha Apollo Hospital Chennai. Uloong ba kajingjur kajingpang Khyllai ni liver kaktabait sak na kajingdi kiat palat. Habakren mata kasngi shiklap tha Khubor Shillong. Uloong ba kajingdon kibadi kiat kalong Haduh Lai puar 0.0% AA ha ka jylla Meghalaya kabakham palat ka jingkheng ha ka ri baro kawe. Kawe pat ka jingpang Khyllai kami na ka jingpang hepatitis lingbau kanyang jingpang mat gala bantre Haduh ban khladro la daw sumar kloya ka. Doktor Elan uloong ba manta ka don gala jing sumar ka jingpang Khyllai bat ka badon kam kalong ban adkar ha ka rukom ki jingbam ki bala ban ktayo Khyllai bat ka jing kilan met ka de shibenta ban pelong yu Khyllai upakot bakhya bat ubaklan bat ubalat na ka jing sop klen. Kawe gala ban sumaru Khyllai ka de ka jing say no yu Khyllai ubasniu bat thep du babha ha ubriu.
So dear friends of press from Shillong, I feel very honored and privileged to be here today with you all. This is my first visit to Apollo Trinity Medical Center to start off the liver health clinics for the people of Meghalaya. I am Dr. Khubor, the head of liver department at Apollo Hospitals Chennai, which you all know is the birthplace of Apollo Hospitals and a marvelous center where all these specialties have been reached at their zenith. So, as you are all aware, liver diseases are increasing all over the world. And in the same context, when I look back into the statistics of health at Meghalaya, definitely liver problems are on the rise and one of the major issues, especially alcohol-related liver disorders, because the average liquor consumption is 32.4% of the entire population, which is much higher than the average elsewhere. And as we all know, continuous high amount of alcohol intake directly damages the liver, and the sad thing is that it presents only at a very late stage. The next major health issue I would like to highlight today is about hepatitis C. We all know about COVID virus, how it affects the lung. We have taken vaccination, we take all the precautions, and we have overcome COVID. But for several decades now, the World Health Organization has been taking very strict measures to eradicate hepatitis from the world. It is possible because there are curative medicines for hepatitis C. Only that it has to be detected at an early stage before the virus will actually damage the liver, and if they are diagnosed at the right stage and the people reach the liver specialist, they can be cured of hepatitis C. And finally, the rising and silent pandemic, I would say, is the pandemic of fatty liver. I think we are all aware that every other person getting an ultrasound of the abdomen is showing fatty liver, and till now even medical practitioners were not very clear about the nature of this disease, the treatment of this disease, and even the treatment options that we had were very limited. And even today, the diagnostic modalities for fatty liver is not available all over the country. Focused because from my own experience, the liver failure due to fatty liver has increased from 5% to 20% in my practice, and if we let it increase, even children are coming with fatty liver. In next 10 or 15 years, we see many more patients with liver failure due to fatty liver alone. And today we have excellent diagnostic modalities. Simple tests like a liver function test and ultrasound abdomen are the initial tests that are required, and then further we need a fibroscan, and with this assessment we will be able to advise appropriately. The next major advancement I would say is about the medication for fatty liver. Till now the role of diet and exercise has been emphasized very well because they are the first step in the management of fatty liver. A balanced diet, low calorie, high protein diet, and 45 minutes of good aerobic exercise is what is required to maintain a healthy liver and lead a healthy life. But then, in some people, if you are not able to cure fatty liver with these measures, we now have curative medicines. US FDA approved medicines like resmetirom is not available in India yet, but other hormonal therapy medicines like terzepatide, semaglutide, these are all the latest medications for fatty liver, which as a liver specialist we have found very successful outcomes. And finally, I would like to say about liver transplantation, because I still believe that the awareness about the success of liver transplantation is not present everywhere. Today, it is a very successful treatment for liver failure and liver cancer with almost 95% success rates. Even the recent advancements like the safe living donor liver transplant surgery, where it is a completely safe operation for the liver donor, and even using the robotic techniques in the donor surgery to reduce complications in the liver donor, doing liver transplantation across blood groups, which is one of the major obstacles in liver donation. And finally, some of the children who develop metabolic disorders, genetic disorders, developmental disorders, they also need to undergo liver transplantation, and it can be done successfully for children even as small as less than 3 months of age.